it's a lot of money. It's money that's super needed in a number of communities that are being hard hit, principally in Alberta, in Saskatchewan, and in Manitoba, where we've really seen a skyrocketing of active cases. And the active caseload that we see, which is sort of a trailing 14-day snapshot, is multiples upon multiples higher than the total case count under wave one. So we got about 5,000 active cases across Canada, which is a pretty it draws a portrait, but it also misrepresents what can happen within a community that's quickly overwhelmed, and their healthcare system in a remote area like Shamattawa over the Christmas holidays, and how a community can easily get overwhelmed in some of the basic stuff like essential services around water and whatnot. So some of the thinking that we've been doing on tailoring funds to sort of walk that path with Indigenous communities as they struggle to, well, first keep COVID out, and when it happens, to prevent or to enable the different stages of their pandemic plans that every community has across Canada. It's one of the first things we ensured was up to date as a community's pandemic plan. And then we'll, in the case where there's a need for what we call surge capacity, sort of assets that Canada can leverage that would not necessarily be available to any particular community. Obviously, in extreme cases, the armed forces, but the Red Cross, contact tracers through StatsCan, isolation tents, which have been probably mischaracterized as tents, but they're really medical units that are quite expensive with negative air pressure to ensure people can do testing and tracking. That all comes at a price. And so the announcement last week has a number of elements to it. The big chunk of it is to bolster the public health response, which is over 600 million over a staggered period of approximately 2 years, to assist communities that will keep reacting and needing specific assets and funding for keeping COVID out of the communities and keeping people safe in conjunction with their pandemic plans. Something that's been very, very popular from the get-go, which is another wave of direct money into communities of about $380 million to give people the finance. What Indigenous communities, what nations have been telling us from the very beginning is, in some sense, we know what we need to do to protect our people. We're used to pandemics, so just ensure that we have the financial firepower to do so. And that was something, it may not necessarily make every bureaucrat in government happy or every person that's a fiscal hawk happy, but what it's done is it's actually enabled people to save lives. And there's been 3 waves of it, and this is the 3rd wave. So about roughly $380 million to support to continue to support communities. So that includes First Nations, Inuit, and Métis that have different needs, obviously, and that is to get money out as quickly as possible into community coffers so that people can implement things like perimeter security, making sure people are taking things seriously. In some cases, that's food security, getting food baskets into people's houses. But anything, that flexibility that we've been asked to do. And so, it is part of sort of a package of, it's hard to put it all together and kind of say this is quote unquote Indigenous, but about a little north of $4 billion that we've targeted specifically to Indigenous communities over the last little while. But that includes a number of things like ensuring food security, ensuring that there's a proper medical response to communities that are having or suffering outbreaks, purchasing of machinery, including gene expert machines, which is a form of rapid testing that's much more reliable than these countertop devices that have been becoming very popular in some of the rollouts because they're new. This types of gene expert machines that we've deployed into many communities, including perhaps Kahnawake, have allowed for rapid testing. And with rapid testing, you can implement 3 or 4 pillars of response to COVID, which is tracking, tracing, isolation, and testing.